And we are stepping forward with our oncology pipeline, and it's a pleasure to ask Dr. Kilian from the Heidelberg University to give a very related talk on the innovations in colonoscopic colorectal cancer screening. So what have we to learn from this? We are excited.
Good afternoon, everybody. Dear Chairman, the audience, thank you so much for having me. So in this last talk, before lunch break, I'm going to talk about how we can increase our adenoma detection rate further by the use of a new technology. I'm a doctor here at the Department of Gastroenterology, just about half a mile west here in Heidelberg. I'm going to talk about three things today. First, how do we measure high quality colonoscopy? What are difficulties during screening colonoscopy? And a new technology, how we can improve our adenoma detection rate. Ideally, a patient that comes to screening is resected with an adenoma in maybe a stage like this. So the patient comes, you remove this adenoma, and he will not develop cancer later on. However, there are also patients that come to screening colonoscopy that do not have adenomas. There are also patients that have polyps, adenomas, that we miss. Adenoma detection rate, Dr. Deschênes has already beautifully introduced this, has become the major quality measure to predict subsequent colorectal cancer development. And by now, endoscopists, they talk about their number, their ADR, almost as other people talk about their handicap during the sport of golfing. And in this study, Dr. Deschênes has already said that the higher your adenoma detection rate is, the less your interval risk of carcinoma development is. And in numbers, each 1% increase of ADI results in a 3% decrease to development, the risk of cancer later on. There are various reasons why we miss adenomas during screening colonoscopy. The more advanced, the more experienced you become as an endoscopist, two things remain. One of being poor preparation, so the patient is poorly prepped, you don't see a lot during colonoscopy. And the next one is the tricky localization of polyps. What do I mean by that? Particularly folds. So this is a view that you have during colonoscopy, and if a polyp is here, you could easily see it. It doesn't take much skill. However, if they hide behind these folds, or just like here, these are easily missed, and it takes a lot of time and a lot of experience to see these during screening colonoscopy. And there's a new technology that has been introduced almost 2 years ago to increase adenoma detection rate, particularly adenomas or polyps that are hidden behind these folds. So this product is called EndoCuff. This is a one-time single-use dispensable rubber cuff that you place on the tip of the colonoscope, and it's constituted of 2 rows of arms. When you move upwards, because they are leaned backwards, this doesn't disturb you much, but when you go back, when you retrieve, when you try to screen for polyps, these arms, they hang to these folds and improve visualization. In a pilot study that tested this device, we learned 2 things. One, the adenoma detection rate was really high, with 47%, and the number of adverse events were rather low. So bleeding after polypectomy and abdominal pain, these are usually not attributed to a cuff. These are things that happen after colonoscopy. And as a result of this, there was a multi-center study, a randomized control multi-center study done by Fleur et al., which was beautifully designed, I have to say. And they compared the use of the EndoCuff screening colonoscopy compared to regular screening colonoscopy. And they saw that the adenoma detection rate was significantly increased with the use of EndoCuff compared to regular screening colonoscopy. So usually we say in women we have about 20%, in men about 30% adenoma detection rate, and we were able to improve this with the use of EndoCuff. There are various reasons that influence the adenoma detection rate during screening colonoscopy. That's why you have to do a multivariate analysis, and doing so we were able to show that the use of endocuff was also associated, independent of all these other factors, of an increased adenoma detection rate. And you see there were no major complications. However, a complication that was seen much more often with the use of endocuff was minor superficial mucosal lacerations. And another study, you see here, these are the tips of these arms, these are polyps that were resected. And for instance, this was a patient with severe thrombocytopenia because of liver cirrhosis. And here you see these lacerations that were attributed to the use of endocuff. That's why the company Norgine developed a version 2.0 that is now called Endocuff Vision. They removed the second row of arms here, and these tips are now 3 millimeters longer. And here I just show you, this is how you use it. So you take it out, you put it on the tip of your colonoscope, and you're pretty much ready to go. So it takes in total about 5 seconds extra time that you need to prepare before using endocuff vision. And the video is not showing. Okay, there we go. So what's happening here is that these arms, they really hold on to your folds, to the plicates, making it easier to detect these polyps. Another thing that really helps you is it stabilizes the tip of your colonoscope. Particularly here around the flexures, you look around the corners and all of a sudden you slide backwards and you have to move all the way up again. This takes a lot of time, and so this second thing that really endocuff vision improves is the tip control, which is fairly important for us endoscopists. There's only an abstract and got published last year. The actual paper is still in preparation, and using endocuff vision in these 4 centers, in each center we had a highly improved adenoma detection rate compared again to screening colonoscopy. And cecal intubation rate, also a measure of high quality colonoscopy, was pretty much the same in both groups, and so far we have not observed any complications from the use of this new assay. So to sum up, the adenoma detection rate is our most important quality standard, predicting the risk of post-colonoscopy colon cancers. And with the use of this new technology, endocuff vision, so far our data shows that we're able to improve ADR and therefore hope to reduce the risk of interval cancers following screening colonoscopy. Thank you.